Aloha gang, Dr. Russ Rosen here. Just want to check and make sure that we're showing up. So I'm going to give me 1 second over here. We're going to go over here and make sure that we're actually live. And let's see if that's true. There I am, far out. Okay, so Dr. Russ Rosen, today we're going to be talking about the examination. And what I know to be true, is that you want to help your patients get the very best results they possibly can, and you want them to understand how different you are, how special you are, what you can actually do for them. You don't want to spend a whole lot of extra time. You want to be able to get it done in the best amount of time possible. And we have to be very careful with overwhelming them with too much information. We've all done that, where we've overwhelmed them and they start to drool. In the last couple of classes, we've been talking about the neuroscience of communications. So we're not going to do that. We'll use the neuroscience of communications. We're not going to overwhelm people. We'll use Socratic questions, stories, and metaphors, and we're going to help them really understand the value of what we do, because we don't want to see their eyes glaze over. Oftentimes, we're not sure how to get them to get the bigger picture of what we do and how we can really help them not just feel better, but get healthy, stay healthy, have the best life possible. So those are things that we want to do during the exam. By the way, I help natural healthcare providers like you thrive in a care versus care true optimal health model. We are here 3 Tuesdays a month, right at this time, 1:30 California time or Pacific time. Please let other people know about it if you find any value. If you want to dive deeper into this information, let me know. I'll give you a free month in the club. This Thursday at 11 o'clock Pacific time, we'll be diving deep into this. And instead of 10 minutes of this, we'll be doing an entire hour where I won't be lecturing at you, but we're in a Zoom room where we're having a conversation, helping you customize it, integrate it, and make it work for you. So I always like to start out with the why behind the how. Oh, by the way, if you're there, go ahead and say, let me know where you are from, and say aloha to me. At the end of going through this, I'll check, and if you have questions along the way, type those in. I'll answer any and all questions. And if you're watching this as a replay or the video recording, go ahead and put any questions. I'll get notified, and I'll answer any and all questions. So what are we trying to accomplish in an examination? Well, I oftentimes like to ask ChatGPT, because I'm so interested in what they say. And I oftentimes am like, wow, that's really great. That is what we should be doing. But it's what very few of us do. Certainly, doctors that I've seen, medical doctors that I've seen, hardly do any of this at all, although they do really great jobs at some of it. Same thing for natural healthcare providers. So these are things that we really want to be able to accomplish. Thanks, ChatGPT, for coming up with this. So we want them to have a holistic understanding, a comprehensive understanding of what we could truly do for them. And I agree with that. And this is a time to educate them during the examination. When I was in chiropractic school, I did a management course during school. I paid to be in a management course. And that guy, who I love dearly, just passed away a bit ago. I'm not going to say his name, because what I'm going to say is that I disagreed with him. But even back in school, he said, this is not the time to educate. This is the time to help them understand that you're a real doctor. You wear a white coat. You do all these things, all these tests, and they're blown away. You literally tell them, I'm using a recorder. It was a micro cassette recorder at that time. And don't talk. Right? I disagree with that 100%. This is the time to educate them. This is the time to help them really get what it is that's going on and how we can really help them. Last time we talked about the consultation. So there's very specific things we're doing in the consult so that I can get into the exam. And the exam is where I'm going to help them really get it. Early detection. Yeah, I agree. This is our wheelhouse, right? This is where we get to the underlying cause of the problem, and we can do early detection on all kinds of things that are coming up, right? So, yep, I agree. Preventative care, again, that's our wheelhouse. If we could get proper nerve supply, if you're a chiropractor, if you can get proper nerve supply to this that is not working now, what would happen in your future? Yeah, you could prevent all kinds of things from happening in the future. It allows us, by doing a great examination, to do personalized care plans for people. Absolutely. Also, continuity of care. Detailed examinations are critical to create a record so that we can then monitor them over time, doing reevaluations and re-reports. Now, for almost all natural healthcare providers, this is our Achilles heel. We don't do a great exam. We don't have very much objective things that we could do. And then it's very hard for us to do reevaluations and re-reports to show them that we're actually doing what we said we would do. The piece that I want to add to this is that this is truly the time for us to educate them. And remember, we're going to use the neuroscience of communications. We're not going to lecture at them. So there are 3 steps during an examination. Step 1 is I need to transition from the consult into the exam. There are 3 things I need to do. I then do the exam where my hands are on them, or I guess if you're doing blood work, then that's the exam. You're doing a scan or an X-ray or whatever it is that you're doing. But this is the time we actually do the examination, and that's what we're going to dive into right now. And then we transition out of the examination. 3 specific things we need to do. Now, we don't have time to go through all of that. We do have time to go into the second one, the most important piece of this. Again, Thursday in the club, I'll be diving into all 3 of these and diving into extreme detail in this particular part. Okay, so we're going to do touch, tell, ask, and teach. It's a way of helping them experience from the inside out that we know what's going on and we can actually help them. Last a month or 2 ago, but we just sent out emails on this and posts. I was, where is that? It's over here. I was voted in as the top 2, as one of the top 20 ultimate influencers in chiropractic. In 2007, I got the Lifetime Achievement Award from Dr. Jen Tempo, Dr. Kent, CLA, and CWA, and it was for this stuff right here, neuroscience of communications, and for these things that I'm going to be going through. I promise you this stuff will change your whole world if you just learn how to do it. There's a phrase that we need to learn, and I want you to write it down. Oftentimes, if you have a subluxation causing blank, we'd expect to see blank. Is that going on with you? Well, that would make sense because blank. Now, obviously, if you're an acupuncturist and you're not calling it a subluxation, what you do is congestion of energy. If you're doing functional nutrition and it's a deficiency, whatever it is, that's what you would do. Because I'm a chiropractor, I'm going to use the word subluxation. So oftentimes, if you have a subluxation causing blank, we'd expect to see blank, and that would make sense because blank. It's so critical that we make it make sense to them. Otherwise, we're doing circular reasoning. So the first thing we're going to do is we're going to connect their chief complaint to subluxation. And again, I know there's all kinds of discussions around, well, is that subluxation, blah, blah, blah. I don't want to go into that right now. So I'm going to use this form right here, this brochure right here. So this has the chiropractic premise right here. Nervous system controls everything. You're getting proper nerve supply, better chance of being healthy. You're not getting proper nerve supply, subluxation could be related to your chief complaint and other problems, etc., etc. We then have the whole story on the back, which is what we review at them. And then we have a type of merit chart in the inside. Now, again, if you're doing brain-based work, you might have the inside be brain lobes and emotions, right? This depends on what it is you're actually doing. If you're in the Learning Center and you're in our program, we have these in Canva where you can change anything, add anything, make it your own. Anyhow, I'm going to walk you through what it might sound like. So Sally has headaches right here. I'm going to touch it right there. So oftentimes, if you have a subluxation causing these kinds of headaches, we would expect to see a tender spot there. Is it tender there? Yes. Well, I think we have found the underlying cause of your problem. And that would make sense because this nerve literally goes to there. I connected the chief complaint to the subluxation. I added the sentence, well, I think we may have found the underlying cause of your problem if I believe that that's true. Okay? Now, oftentimes, now I look at motor, sensory, and autonomic. Oftentimes, so what would sensory be? Well, clearly a headache. It could be lesser or greater occipital nerves so that they have like a burning sensation along here or here, headaches that come around here. There's not going to be any motor that we're going to be talking about. So oftentimes we'll see that people will have discomfort along here, brushing your hair like I do, and there's a little bit of a tender spot right there. Oh yeah, I get that all the time. Well, that would make sense. Look at the nerve chart. This nerve literally goes to right there. Start over. And oftentimes, if you do have a subluxation causing those kinds of headaches, autonomic, we might expect to see spaciness, dizziness, mood swings, brain fog, eyes, ears, nose, throat, sinus issues, ADD, ADHD. Did you ever get any of those? Well, I get sinus problems all the time. Well, that would make sense because this nerve doesn't just go to here causing headaches, but it also affects sinuses, right? I'm just going to connect the dots for people. If you want to get this, just go into the club. So just put club below. I'll give you a free month in the club. You can go ahead and download this. And that and a ton of other stuff. Okay, so I've connected it to the chief complaint. I did motor, sensory, autonomic. Now I move to a different area. Now I'm going to palpate down. So how long does it take to palpate down and find another major area? About that fast, right? So oftentimes, if you do have a subluxation here, we'll find another one down about there. Is it tender there? Yeah, well, that makes sense. The body compensates, right? Another subluxation right in that area. Do you ever get? So oftentimes we have that motor, sensory, autonomic. So motor, C5, yeah. Sensory, numbness, tingling, pain, weakness, motor, down your shoulder, elbow, arm, hand, fingers, right? So I'm not saying, well, C5 actually goes to the what is that, the delt? I think, yep, to the delt. I'm not doing that. I'm just saying shoulder, elbow, arm, hand, fingers because we're looking at the plexus, right? It's an entire plexus. So do you ever get any numbness, tingling, pain, weakness, motor, down your shoulder, elbow, arm, hand, fingers? Yeah, I get carpal tunnel. I get tennis elbow. Oh, well, that would make sense because this nerve goes to there, right? Autonomic. I'll take a look at the autonomic in the chart and ask, do you have that going on? So I'm going to go down the entire spine if I'm a chiropractor, and I'm going to find the 2 or 3 major issues. Now, at the end, I can then have them take a pen and go through and circle chief complaints and underline any other things going on, and then I can correlate it with the findings, right? With my x-rays, with my palpation, etc. I'm certainly not going to go through each and every one of these. It takes forever. I just need to help them see that the subluxation could be related to their chief complaint as well as something else. And I do have sugar handling issues, and I do have pain down my arm, and I do have indigestion, and I do have pain down my leg, and I do have constipation. Wow. Isn't that amazing? How did you know that that was going on with me? Right? So there's a whole lot to this. We would connect it to their 3 dimensions of stress, the things that happened to them, physically, mentally, emotionally, biochemically. We would connect it to their lifestyle. So you're a golfer and you're only doing this motion. No wonder you have that going on. We're going to prove our case. Now, oftentimes, if you do have that going on, we'll notice a limited range of motion. Turn your head to the left, turn your head to the right. Wow, do you see it doesn't want to go to the left, but it goes to the right? Well, that would make sense because when you're subluxated, the nerve interference causes the muscles to pull on the bones and tighten up. And does it feel stuck? Yes. Does it feel tight? Yes. Then you must be what? Then I must be subluxated. I'd agree. So you'll see that through the whole thing, just like in the consult, I am drawing their story out of them. I'm applying what I want to teach them to their story. I'm not lecturing them. Let me show you this chart. I'm not doing that. I'm simply drawing their story out of them. And do you ever get this going on? Wow, I do. I have indigestion. How did you know that? Well, these nerves go to these organs. And if you're not getting proper nerve supply, wouldn't it be far out if as we were getting this taken care of, that stuff cleaned up too? Wouldn't that be great? Okay, so there's a whole lot to this. Eventually, I've got to get them to say, I know where my subluxations are. I know what they could be causing. I know what brought them on. I know what happens if I don't get it taken care of. If I do get it taken care of, not only could I feel better and prevent problems in the future, I literally could be healthier in 5 years than I am right now, and I could have a better life. I understand that this is a health problem, not a back problem, and I want to get healthy and stay healthy. So we're planting seeds for the reported findings of I want to get healthy and stay healthy versus just getting them out of pain. Dang it, I try and keep these 10 minutes or less. I've been told any longer than that, people just won't check them out. So that's 15 minutes. I apologize for that, but this is such a huge piece. We will be doing an entire hour on this subject Thursday of exactly how to do it, all the details, etc., etc., etc. So I'm going to go ahead and check below. Daryl Hayes of Utah, aloha, welcome aboard. New Jersey, new NP student right now. I'm not sure what NP is. Always looking for a better way to communicate with my patients, have a holistic background far out. Hope this helps. If you are holistic, again, oftentimes if you've got a congested organ, because we're using the nutrients, oftentimes if you have a deficiency, oftentimes if you have a brain lobe, oftentimes if you have congestion of energy, acupuncture, oftentimes if you have this type of organ imbalance, we'll see this in your blood work. It doesn't matter the type of work that you do at all. What matters is you understand the basic way of having that conversation in a way that they can hear it. And trust me, if you're talking to them about them, they're interested. They're going to get it. It's going to get past the reptilian brain of the neocortex for thinking, reasoning, and problem solving. It'll drop into the limbic system as a new belief system, and you'll get Rosenites, right? You'll get Halelites and Petersonites. Okay, so appreciate you being on the call here. Thanks for letting me know you're here. If you have any questions, if you're watching this, just go ahead and ask any questions, and I will help in any way that I possibly can. Please let others know about this. If you want to dive deeper, please jump into the club. Just put club below and I'll send you a free month. All right, as always, next week we'll be diving into the reported findings. As always, much love and aloha. Bye, gang.